Let's talk about the basic principles of external fixators. Part 1. External fixation is a fracture stabilization method with ancient roots, dating back over 2,000 years to the time of Hippocrates. The main goal is to maintain length, alignment, and rotation of a fractured limb while the bone heals. It stabilizes the fracture from the outside, which helps preserve blood supply and can minimize additional injury to soft tissues. External fixation can be used as a temporary stabilizer in the emergency setting or as a definitive treatment in selected fractures. In both cases, it usually provides relative stability. A major advantage is that external fixators allow access to wounds and soft tissues, which is crucial in open fractures. Common indications in trauma include mangled extremities or open fractures at high risk of infection, damage control orthopedics in critically injured or unstable patients. For example, in pelvic trauma, an external fixator can stabilize the pelvis quickly. Closed fractures with severe soft tissue injury, such as a high-energy tibial fracture with degloving or risk of compartment syndrome. In these cases, the fixator acts as a temporary bridge. Joint spanning fixation, this protects the joint and soft tissues until definitive fixation is feasible, and fractures in the presence of infection, when internal hardware may be unsafe. Now, external fixators come in different designs, but we often describe them by the configuration of pins and bars. Unilateral uniplanar fixator. Unilateral means the external hardware is located mainly on one side of the limb. Uniplanar means the frame is built mostly in one plane. Bilateral uniplanar fixator. Bilateral means the frame is built on both sides of the limb. Uniplanar because it is still mostly in one plane, with pins oriented in the same general direction. Unilateral biplanar fixator. Unilateral because the pins still enter from one side and attach to the frame on that same side. Biplanar means the construct has two planes of support. Bilateral biplanar fixator. The external fixator occupies both sides of the limb and supports the load in two different planes. An anterior or oblique bracing rod can triangulate the frame. Triangulation adds depth, making the construct much more resistant. Ring fixator. A ring fixator is built from circular rings that surround the limb. The rings are connected to each other with rods or struts, creating a closed frame around the bone. The bone is attached to the rings using thin transfixion wires, often tensioned and sometimes half pins. Mechanically, it is strong because it is a closed circular frame. The load is shared around the ring and through multiple wires and struts. This design helps resist bending and torsion in multiple directions,